Dr. Jigyasa Pasi, Assistant Professor, Department of Anatomy, Hamdard Institute of Medical Science and Research, New Delhi. So we begin today with Axilla Part 1. It will be covered under 3 parts. So the learning objectives for today are that at the end of this lecture, we should discuss the boundaries, the apex, base and walls of the axilla, discuss the contents of the axilla, that is axillary artery and branches, discuss the axillary vein and tributaries, and discuss the axillary nodes. This is in accordance with competency 10.1, which says identify and describe the boundaries and contents of the axilla. Right, so coming to the axilla, there's a truncated structure over here. So we can see that the arm is abducted, and this is where the axilla is basically found. So the surface marking of the axilla with the apex over here, the base is formed by is over here. This is the A stands for the anterior axillary fold and P stands for the posterior axillary fold. The anterior axillary fold is formed by the pectoralis major, whereas the posterior axillary fold is formed by the latissimus dorsi. This picture, the location of the axilla becomes a little more clear. So this is the apex towards the neck. This is the base or the floor, the medial wall towards the chest wall, the lateral wall towards the humerus, and this is the posterior wall towards the scapula. Right. So furthermore, when we see the boundaries, we can identify the green to be the apex, the yellow to be the base, the anterior wall is lined by black dots, the posterior wall you can see, the medial wall towards the chest, thoracic cavity, and the lateral wall towards the humerus. So coming to the apex has been described as the cervico-axillary canal in the sense that it gets the contents from the cervical or the neck area into the axilla. And this is a truncated structure which is directed upwards and medially, and it communicates with the neck. Now, this is a sagittal section showing, I just wanted you to see, this is the base of the axilla, which is found by the fibrofatty tissue. Here, this is again the base of the axilla, which is found, which has abundant fat. So coming to the bones forming the boundaries of the axilla, anteriorly placed is the clavicle, posteriorly placed is the scapula, medially we have the ribs, and laterally we have the humerus, or basically the intertubercular sulcus. These are the two tubercles, the greater and the lesser tubercle, and in between we have the intertubercular sulcus, which is forming the lateral boundary of the axilla. Right. So the anterior wall, this is the axilla. When we remove it, you will find the axilla, the anterior wall formed by the clavicle, the pectoralis major and minor underneath it, the subclavius underneath it, and then we have the clavipectoral fascia, underneath which we have the suspensory ligament of the axilla. Right. So the anterior wall, if this was the axilla over here, the anterior wall is more clear over here, which is found by the pectoralis major. When we remove this, we find the pectoralis minor and the subclavius, and all these three muscles are forming the anterior wall of the axilla. Here. So coming to the posterior wall of the axilla, this is the axilla. This is our anterior wall formed by the pectoralis major. Now the posterior wall is formed by teres major. Teres major, the subcapsularis, and the latissimus dorsi. Here, similarly, we see in this picture again, we have the teres major, minor, latissimus dorsi, and the subcapsularis. Another view showing this is the Gray's Anatomy view showing the posterior wall of the axilla with the subcapsularis. the teres major, and the latissimus dorsi. Coming to the medial wall, this is the medial wall. We all saw that there were upper four ribs involved. The upper four ribs will also contain the intercostal muscles along with it. The serratus anterior upper part, if you remember, we have the attachment of the serratus anterior all through the chest wall, which will also form the medial wall of the axilla. Along with the long thoracic nerve, which supplies serratus anterior, also called the nerve of Bell. Here, this is the serrations of the serratus anterior muscle. If you remember that this attaches onto the medial costal wall of the axilla. Of the scapula. Coming to the lateral wall is formed by the bicipital groove of the humerus, the teres major, latissimus dorsi, pectoralis major. These are the muscles of other walls also, but principally we have the long head of biceps, the short head of biceps, and the coracobrachialis forming the lateral wall. Here, as you can see here, laterally, this is the lateral wall, tendon of long head of biceps. So this is your axilla, and we come to the contents of the axilla. As the name suggests, the contents will be axillary vein, axillary artery, and the brachial plexus. The brachial plexus will be dealt with separately. We'll talk about axillary artery first. Right, so coming to the contents of the axilla, we have the axillary artery along with its branches, the axillary vein along with the tributaries, the brachial plexus cords and the branches, the long thoracic nerve of Bell, intercostal-brachial nerve, axillary fat obviously, alveolar tissue obviously, axillary lymph nodes, and the axillary tail of breast. So the structure is passing through the apex. Remember, it was called the cervico-axillary canal. Okay, so the axillary vessels are coming along, the cords of the brachial plexus are coming along, long thoracic nerve and the lymph node efferents are coming along the apex. Here is the axillary artery. Here is the axillary artery. It has an upper limit, a lower limit, and then it has branches. So we'll discuss in the next lecture about the branches and the relations of the axillary artery. Thank you.